Many people believe that weight gain is simply about eating too much and exercising too little. While those factors matter, your body also relies on a complex network of hormones that regulate hunger, fullness, metabolism, and fat storage. When these hormones become unbalanced, gaining weight can become much easier, and losing it much more difficult. So how do hormones affect weight? Hormones are chemical messengers that travel through the bloodstream and tell different organs how to function. Several hormones work together to help control body weight. One of the most important is insulin, which helps move glucose from the bloodstream into cells for energy. When insulin levels stay high for long periods, often because of insulin resistance, the body is more likely to store excess energy as fat, especially around the abdomen. Another important hormone is leptin, which is produced by fat cells. Leptin tells the brain that the body has enough stored energy and helps reduce appetite. However, many people with obesity develop leptin resistance, meaning the brain no longer responds properly to leptin's signal. As a result, the brain continues to think the body needs more food, even when energy stores are already high. On the other hand, ghrelin is often called the hunger hormone. It is mainly produced by the stomach and increases before meals, making you feel hungry. After eating, ghrelin levels normally fall, helping you feel satisfied. The thyroid hormones, T3 and T4, also influence body weight by regulating how quickly the body uses energy. When the thyroid is underactive, known as hypothyroidism, metabolism slows down, making weight gain more likely. Another hormone, cortisol, is released during stress. Short-term increases are normal, but long-term stress can keep cortisol levels elevated. This may increase appetite, encourage cravings for high-calorie foods, and promote fat storage, particularly around the abdomen. These hormones do not work independently. They constantly communicate with the brain, pancreas, stomach, thyroid gland, and fat tissue to maintain energy balance. When one part of the system is disrupted, the entire network can be affected. The understanding of hormones and weight has improved greatly as scientists discovered how the endocrine system, metabolism, sleep, and the brain interact to regulate appetite and energy use. Managing hormone-related weight gain focuses on treating the underlying cause. This may include healthy eating, regular physical activity, improving sleep, reducing chronic stress, treating thyroid disorders, managing insulin resistance, and using medications when appropriate. Sustainable lifestyle changes remain the foundation of long-term weight management. Today, artificial intelligence is helping doctors better understand the factors behind weight gain. AI can analyze wearable device data, sleep patterns, activity levels, food intake, blood test results, hormone levels, and continuous glucose monitor data to identify patterns that contribute to weight gain. Researchers are also using AI to personalize nutrition and weight loss plans, helping patients receive recommendations that are tailored to their unique metabolism and lifestyle. Weight gain is influenced by much more than calories alone. Hormones play a vital role in controlling hunger, metabolism, and fat storage. Understanding how these chemical messengers work helps explain why maintaining a healthy weight requires a whole-body approach rather than focusing on a single factor. We've now completed our journey through metabolism and hormones. In our next section, we'll explore the urinary system, beginning with how the kidneys work and discovering how these remarkable organs filter your blood and keep your body's fluids in perfect balance.